Osteoporosis is a disease of low bone strength that leaves an individual at high risk for breaking bones when bones would not normally be breaking. Broken bones are important because they can affect our quality of life. They can cause us to be disabled. They can increase the risk of death if it's a fracture of the spine or hip. But what's most terrifying for most of us is loss of independence. And all too often we see that after a hip fracture, patients wind up in the nursing home if they survive the fracture. Sometimes they're no longer able to drive a car or get around to shop and visit their grandchildren the way they'd like to be doing. A major risk factor for osteoporosis has to do with your genetic composition. If you are unlucky enough to be born to parents that have given you a high risk for osteoporosis, there's nothing you can do about that. But a good portion of the risk for osteoporosis is environmental in origin, and it has to do with maintaining a healthy lifestyle and having good nutrition. So that means exercising regularly and being sure to get enough calcium and vitamin D, and avoiding things that are bad for your health and bad for your bones, such as cigarette smoking or drinking too much alcohol. Anyone can get osteoporosis, but the majority are women. About 80% of patients with osteoporosis are women. Being postmenopausal and estrogen deficient is a risk factor for osteoporosis, but men can get it as well. And men are too often ignored in the care of osteoporosis, and men have a hard time admitting they have osteoporosis. So it's very important, if a man over the age of 50 has a fracture, that he be considered for osteoporosis. And if any man age 70 and older is now recommended to have a bone density test to find out if he might have osteoporosis. Well, there's two major ways we know that. One, if you're over the age of 50 and you break a bone that's not from a major accident, it's very likely that you have osteoporosis. But the best way to diagnose osteoporosis is by means of a bone density test. This is a very simple test where all you have to do is lie down on a table, your bones get scanned in a few minutes, and we come up with a number called a T-score that represents your bone density. And we use that number to help us to diagnose osteoporosis. It's recommended that all women age 65 and older, for example, and all men age 70 and older have a bone density test. Fortunately, we have many excellent treatments for osteoporosis, and they come in a variety of forms. We can treat osteoporosis with pills that are taken once a week or once a month. We have IV injections of medications that can be taken once every 3 months or once a year. We have subcutaneous injections, just a little shot in the arm that can be given every 6 months to treat osteoporosis. And finally, for patients at very high risk for breaking bones, we have injections that are self-administered by the patient at home once a day for 2 years, a little bit like a diabetic giving an insulin injection. Without clinical research, we wouldn't have any medications now for osteoporosis, and if we're going to develop better ones that are more effective and safer than the current ones, then we need to continue doing research. So we're constantly looking at new ways to manage osteoporosis, taking advantage of what we've learned about the mechanism of osteoporosis in the first place.